essentially I have confirmed that he does indeed have a meniscus tear. His history is very concerning for one, and his exam is concerning. He has swelling, he has joint line tenderness, he has a positive McMurray's. So as far as treatment is concerned, people oftentimes ask me, will a steroid injection or an injection into the knee help with this? And an injection can help with a meniscus tear really only if there's other issues going on. If he had some patellofemoral symptoms, if he had some kind of global inflammation in his knee where he had some lateral joint line tenderness, but his pain and symptoms are all right here on the medial or inside part of his knee. And with an isolated meniscus tear, as if Scott has, an injection usually doesn't do that much to help relieve symptoms. So the treatment for this is therapy, and since Scott's a physical therapist, I was going to have him tell us what he would do to treat himself for his meniscus tear.
Well, there is a priority, and so one of the first things I always want to do is I want to try to get my swelling under control. So I do practice that RICE method, which is an acronym. It stands for rest, ice, compression, and elevation. So I've been icing it and compressing it and elevating it and trying to get the swelling under control. The other thing I want to do is I want to keep my range of motion. It's real easy to avoid end range motion. So, sometimes it hurts to fully straighten it. It definitely hurts to fully bend it. So I try my best to maintain that full range of motion with some basic motion exercises. And then, of course, I want to try to maintain the strength of my thigh muscles. And so I'm doing some strengthening exercises for my thigh muscles. I'm doing some flexibility exercises for some of the muscles in the back of my leg. And so basically, just to kind of summarize, I'm getting my swelling under control. I'm maintaining my basic motion of getting the knee to fully straighten and getting the knee to fully bend. I'm trying to keep the strength of my thigh muscles. I'm trying to maintain some flexibility in the back of my leg. And I'm doing my very best to try not to limp, even though I want to limp because it seems to feel a little bit better when I do that. But I know that's not good for me, so I try my best to practice what I preach and try to walk normal.
So you said trying to control your swelling. I found that even doing things like quad sets and working on terminal flexion can be a good way to adjunct that. What are your thoughts on that?
Yes, so when I'm doing strengthening exercises like tightening up my thigh muscles, just that pumping action of the muscle.
Show me what you mean by quad set.
So to give you a demonstration here, so I would be working on pressing the back of my knee down. Now, when my knee goes down, one of the things you'll notice, because I've got pretty good motion in my knee, is that my foot pops up in the air a little bit, but that tells me that I'm using my thigh muscle. So I press my knee down, I hold that muscle tight for maybe 3 to 5 seconds, and then I gently release. And I repeat that for about 10 to 12 repetitions, but it's the pumping action of the muscle that's helping to drive some of that fluid out of my leg.
Gotcha. Thank you. So what we're trying to do is control the symptoms until we are able to get this tear to go away. So what happens with a tear is, with time, the body will slowly tear off little tiny pieces and eventually get rid of the tear like that. So as you can see here, the tear is now gone as the body has slowly broken it up and absorbed it. So that's why arthroscopies work. Essentially, they do the same thing that your body will do, only we go in surgically and we find this tear and we clean it up. So essentially, we're just taking out that part that's getting trapped and pulled, and we take it out like your body does with time.
I do have one specific question. I have a lot of patients that we work with that have meniscus tears, and so we're giving them exercises to do. And one of the most common questions that I have is, this initially is hurting to do some of these exercises. Isn't this just making my knee worse? Isn't this just going to make the tear worse? So how would you answer that for a patient?
Thank you for bringing it up. There's a very common concern that people have. And no, doing the exercises and ignoring a meniscus tear will not make the symptoms worse. It will not make the tear worse. You're not doing any damage to your knee. You're not hurting the cartilage. You're not hurting the meniscus tear any worse. It's a torn meniscus, and if it's going to get worse, it'll get worse anyways, but doing the exercises and ignoring it will not make the tear worse, nor cause any structural or underlying damage to your knee. Studies show that doing a meniscectomy helps at a year about the same as doing physical therapy. So a lot of times if you can just ride this out for the first few weeks, then the symptoms seem to get better and the body will slowly absorb that meniscus tear. Thank you for watching. I hope it was helpful. If you liked this video and found it informative and would like to have further information, please check out our YouTube channel as we have many informative videos there. Please also subscribe to our video channel and you'll get weekly updates with new information.